3, 2, 1.
Good morning, everyone. I'm Councillor Carol Runciman, and this is my decision session for the Executive Member for Health and Adult Social Care. I'm going to ask the other two people on the screens to introduce themselves. Sharon, please.
Hello, I'm Sharon Stoltz, Director of Public Health.
And Patrick.
Hello, I'm Patrick Looker. I'm the Head of Service Finance at the Council.
Thank you. So item 1, declarations of interest. I have no further declarations of interest other than those that are already on the register. Item 2, the minutes. I'm happy to approve the minutes, although at the moment I can't sign them, but I will accept them. Item 3, public participation. We have nobody registered to speak at this session. And so we go on to the main business of the meeting, which is the public health grant allocation. Sharon, are you going to outline how the allocation will be used?
Yes, I will, Councillor Runciman. So as I think most people are aware now, public health responsibilities transferred into local government in April 2013, and local authorities receive an annual grant allocation, the local authority public health grant allocation as it's called, to allow them to deliver those public health responsibilities. The majority of the public health grant in York is used to deliver our statutory service provision or mandated public health services. And because of the constraints on the grant, we obviously have to make very careful decisions as a council in how we spend that money. So in the report at paragraph 10, there is a breakdown in the table there of how the budget has been spent. So our allocation being just over 8 million a year. What we have, though, received this financial year is some non-recurrent additional monies for the Department of Health and Social Care, in addition to the grant for some specific areas of public health activity. So we've received some additional funding for the rollout of pre-exposure HIV prophylaxis. We've also received additional money for adult weight management, and additional money as well for additional drug treatment, crime and harm reduction activity. Because the responsibilities for domestic abuse transferred over to myself as Director of Public Health and my team earlier in the year, we've also received an allocation to deliver our statutory duties as part of the Domestic Abuse Act. Now, all of those budgets were given as ring-fenced, non-recurrent allocations for this year. So the report does highlight a risk to the council if that funding isn't made available to us in future years as part of the public health grant. I've received verbal assurances from the Department of Health and Social Care that funding is likely to continue. But obviously there is a risk that we acknowledge there until such time as the council receives confirmation of the level of funding that we'll get next year and future years. We then have accrued a public health reserve. This has been accrued for a number of reasons. We are always very careful to make sure that we keep a public health reserve every year to be able to deal with any unexpected emergencies, particularly any health protection issues that might arise. We have so far in the COVID pandemic received additional money from government to pay for the testing and contact tracing activity. But of course, disease outbreaks can happen at any time without warning outside of a pandemic situation. So we always keep a reserve to be able to respond to that and any other issues that might arise. So that reserve has accumulated where we've not had to use it in the past. And then because of the last 18 months or so, we've been dealing, as our partners have been dealing with the COVID pandemic, some planned activity didn't take place. And so we've accrued a reserve over that period as well. And so what the report also covers, starting from paragraph 12, is our priorities for investing and that reserve. And that is based on intelligence that we have, our joint strategic needs assessment, and very much linked to priorities that have been identified either within the council plan or in the health and wellbeing strategy. So the areas that have been prioritised are around helping children to have an early start in life, with some additional investment into the Healthy Child Service, into the multi-agency safeguarding hub, with additional capacity to respond to safeguarding concerns, strengthened our capacity to be able to carry out health reviews with children in local authority care, investment into improving access to the Healthy Start programme for low-income families, and also into the Henry programme to support our work around childhood obesity. We've also then identified mental health as an area for investment. We know that the pandemic has had an enormous impact on the mental health and well-being of residents. So the investment that we've identified isn't into mental health services provision, because that falls outside the criteria for use of the public health grant. But we've really focused on working in partnership with York CVS, who are providing the Time to Change programme. So that's really about addressing the stigma that's associated with mental health issues, with a real focus on prevention and early intervention. So I'm really pleased that we're able to work in partnership with York CVS on that very valuable programme. And then in partnership with GP practices across York, we also have worked to revise the way in which we deliver stop smoking advice, investment into supporting pregnant women to quit smoking, and also developing a care pathway for GPs who might be identifying patients at risk of developing diabetes. They may have alcohol misuse issues. They may need support to become more physically active, etc. That work with GP practices, we wanted to strengthen our input into the health trainer service. So that's an area that we've identified for investment. Another really important area, because we understand the impacts that COVID will have had on residents, and the negative impacts that might have had on people's weight and on their levels of alcohol use.
Sharon,
the
can I just,
final,
sorry, before
sorry,
you go
Catherine.
further, you just mentioned smoking in pregnancy. Can you tell me how the numbers are going? Are they going up, going down, staying the same?
Well, I'm really pleased to be able to report that data that we received just yesterday, in fact, shows that our smoking in pregnancy figures are reducing. They've been higher than the regional average for periods over the last couple of years. They've now fallen below the regional average and are heading in the right direction, which is really, I think, a testament to the joint working the public health team have been doing with maternity services at the hospital. So very much a joint approach with midwifery services as well.
Well, you had a concluding comment you wanted to make.
Yes, just to say that the final area then we've identified for investment, I'm sure won't be any surprise to anyone, is health protection. Health protection is a core statutory function of public health teams. And of course, the focus over the last 18-19 months has been on COVID, but even during COVID, there have been other health protection incidents that we've needed to deal with. TB is one, working across border with North Yorkshire County Council on avian flu outbreaks. And of course, this work also includes infection prevention and control, and working closely with care homes and with the NHS, etc. on that. So I'm pleased that we've been able to boost our capacity to deal with health protection incidents as well. So those are the areas that we've identified for in investment, Councillor Runciman, and I don't know whether Patrick wants to say anything more.
I want to ask Patrick a question anyway before, and then he can make any comments. Patrick, why can't the reserve just go into the general fund?
As it stands, the public health grant is a ring-fence grant whereby it has to be spent on specified measures. What the legislation does allow for is underspends to be carried forward into a specific earmarked reserve, but they do then need to be spent on public health matters.
Does that all have to be spent by the 31st of March?
No, the government understand that there will always be peaks and troughs in terms of spending, and there will be fluctuations, which is why they have allowed the level of public health grant. What the Department of Health are able to do is to consider whether our reserve is too high, in which case potentially they could come back to us and ask for money back. So it is important that we don't allow the public health reserve to get to such a level where that would happen, which is why it's important to look at ways of reducing that by investing in the priorities that Sharon has obviously outlined as part of this report.
Thank you. And I've just got a couple of questions for Sharon, and then if there are any concluding remarks. Sharon, capacity has been in question, hasn't it? And you mentioned that in your report. Can you just say what has been done about that?
Yeah, so there are two aspects to this, really. There's obviously the additional capacity that we've needed to develop within the public health team to respond to the pandemic. And that includes our local testing and contact tracing service, for example, as well as public health leadership of the pandemic across the city. So we've been able to create a number of fixed term and agency posts to respond to the to the pandemic. We have now received written assurances from government that the COVID grant funding will continue at least until the end of March. So that activity and additional capacity is being funded by the specific COVID grant that we've been given. But then there is the kind of peacetime, as I call it, health protection work, the health protection work that is ongoing. And certainly when we had the peer review report that is mentioned in the executive report today, it highlighted that as a small public health team, we really didn't have sufficient health protection capacity to be able to deal with the various health protection issues that can arise. And so some of the reserve has been invested in creating an additional post, an additional public health specialist practitioner post in the public health team that will be working to support the nurse consultant in public health in leading on that health protection agenda.
Good. And the other thing, Sharon, I wonder if you could just highlight for the people watching and listening what we're doing about having the responsibility for preventing or lessening domestic abuse, which has just come over to public health recently.
Yes. So the detail of the new statutory responsibilities that local authorities have with domestic abuse was outlined in a report that went to the executive last Thursday, for anyone watching who is interested in reading the detail in that report. But just to give an overview, the Domestic Abuse Act is particularly concerned with the provision of safe accommodation for families. It's important to explain that domestic abuse people tend to think of as against women, and women are certainly the most often affected by domestic abuse. But men can be victims of domestic abuse as well. And the new Act also recognises children as victims of domestic abuse who may be in a household where they witness domestic abuse occurring. So there are specific obligations that have been strengthened for local authorities around safe accommodation. And also a focus on how we can prevent domestic abuse. So the work that we can do around citizenship in schools, for example, to raise awareness of all forms of domestic abuse, and then also thinking about perpetrator programs to rehabilitate those people who have committed domestic abuse, to look at kind of supporting those two, so that they are not in a position where they continue to abuse, but that they're rehabilitated. So quite an extensive program. Because the funding we've been given as a local authority this year is, we don't know whether we'll continue to receive that level of funding. This year we are focusing on completing a detailed needs assessment. We're also going to be commissioning training for staff, and also doing some engagement with victims of domestic abuse to gain a better understanding of the needs that they have and how we can best support them. And we'll be doing that work jointly with the voluntary sector across North Yorkshire County Council, because domestic abuse doesn't respect local authority boundaries, so it requires cross-boundary working, but also clearly with the police and the police fire and crime commissioner as well. So we'll be jointly commissioning some programs of work.
Good, that's good. That's work in progress, and I'm really pleased to hear that we're talking to people with lived experience, because I think that's really important. Patrick, do you have anything else you'd like to add?
The only thing is really, obviously we don't know yet what the public health grant will be next year. That's still not to be announced, and as Sharon has laid out, there are additional responsibilities coming through. So once we know what that public health grant will be next year, we'll revisit a number of the assumptions. The budget, you had your decision session earlier around the budget, that assumes that the public health grant will again be fully ring-fenced and passported across to public health, so to be spent in this particular area.
Yes, we're never quite sure, are we, until we actually get it in writing, as it were. Sharon, is there anything else you would like to add in conclusion?
I think my final comments, Councillor Runciman, would be that the York public health function is regarded as being a highly effective function. We have had a number of reviews of the public health function over the last 2 years. We've had a sector-led improvement review that was carried out independently through the Association of Directors of Public Health. We've had a local government association peer review, and there's also been an internal audit of our health protection functions. And I think that really is able to give yourself as the executive member with a public health portfolio, but also any residents that may be watching, that assurance that we have a very good, strong and effective public health function in York. And you know, that's to the credit of the fantastic public health team that we have within the council.
Yes, I think I'd like to put on record my thanks to them all. They've worked so hard right through the pandemic, unstintingly given of their time, and they deserve our thanks. And also, I hope they have a bit of a rest over Christmas, so I'm not sure that all of them will. So I'd like to agree the update on delivery against the agreed budget savings and priorities for investment of the non-committed public health grant, and authorise the DPH in consulting with myself and the finance officer to take all steps required to manage the public health grant reserve in accordance with the criteria for its use. After that, we go on to the final item on the agenda, which is any other business, and I haven't been notified of any other business. So I will now bring the meeting to a close and thank both Sharon and Patrick for giving of their time and their expertise this morning. Thank you.